Good morning, everyone. Welcome to the Stanford Health Community Needs Health Assessment Community Conversation. We're very grateful to be hosted by the town of Darien in this beautiful town hall. I'm just going to give you a few housekeeping items right now, and then I'm going to pass things off to First Selectman John Zagrodski, who is here with us. So as housekeeping matters, first you have index cards next to your seat. If you would like to ask a question during the Q&A period, please take a moment to write a question, and I'll collect them throughout the presentation. If you take a moment to please silence your cell phones, including you, Ben. This event is being recorded. There are exits back there. The restrooms are on either side of the exits. And if you did not pick up a CHNA report, there are copies outside of this room and in the back of this room, or you can raise your hand and we'll bring one for you. And with that, I would like to introduce First Selectman John Zagrodski. Mr. First Selectman.
Mr. First Selectman, so formal, good heavens. Anyway, I appreciate everybody coming today. This assessment is important for a lot of reasons, but it gives us I think a much deeper insight in terms of community health, how people perceive that, and what some of the important issues are that we need to focus on, and it gives us a sense of prioritization. I also wanted to just thank everybody for the time and effort that was put into this, and particularly welcome Kathy, you and Ben coming by here today. It's a real privilege to have you guys come by and spend some time with us about that. What I would encourage everybody to do is to take notes from all of this, and if you've got questions about that or anything from the professionals who are here, but also from me or from anyone else, where you want to have a discussion about where we need to take things, or if there's a particular priority that's of interest to you that you want to learn more about, or you think something that we should do more of to focus on community health needs for the town of Darien, I'd like to hear from you. This is an important topic, and that's why I'm here today. So again, thank you all for coming, and let's get started.
Good morning, everyone, and thank you, John. I'd like to thank all of you as well for coming here this morning to participate in our community conversation. Our focus today, as you heard, is on the Community Health Needs Assessment, or something we call the CHNA. As your local health system, we are actually required every 3 years under the Affordable Care Act to conduct a Community Health Needs Assessment. But it's more than a mandate for us. At Stanford Health, we take our community health needs assessment very, very seriously. We feel that it is part of fulfilling our mission as your local health system, under which we are committed to focus on the communities that we serve. And you'll see on the slide that this actually is Stanford Health's mission statement. It's been our mission statement for a long time. Every few years we look at it to see if it still reflects who we are and what we want to do. And it certainly does. So we're focused on the healthcare needs of our community. You probably know already, but Stanford Health includes Stanford Hospital, the Stanford Health Medical Group, which has a couple of hundred physicians in it. We have over 1,000 physicians on our medical staff, and the Stanford Hospital Foundation. I hope you're also familiar with our growing ambulatory network, which now includes over 40 offices embedded in communities to meet their healthcare needs. And here in Darien, we have primary care offices, adult primary care and pediatrics. We have an imaging center over here and a number of specialists that come. You may not be aware, but our primary service area for Stanford Health is actually Stanford and Darien. And the other offices that we have, which stretch from Greenwich all the way up to Westport, are actually our secondary service area. You may not know, but thanks to your support, we're one of the relatively few community health systems that remains independent and community-owned. We're not a part of any other health system, and we can be proud of that because we are one of the finest. Just this year alone, we were named as a high-performing hospital by U.S. News & World Report, and we were recognized in over 12 areas, clinical areas, and we were ranked the #1 hospital in Fairfield County. And we're very proud of that. We were awarded an A hospital safety grade by the Leapfrog Group for the 5th consecutive rating time in a row. And why is Leapfrog important? They're a watchdog agency that looks at hospitals across the country and looks at metrics around safety and quality and how we treat our patients. And to have an A grade consistently is truly reflective of our passion and our vision. And we are also certified as a great place to work for 5th year in a row. We have 4,000 employees, and I am very dedicated to our employees. I tell them they're our most precious resource, because without them, there is no way that we could do the fine work that we do. In addition to these recognitions, we've also expanded access to care with the opening of new walk-in centers in Wilton and Norwalk, and a new location at 260 Longridge, which offers a variety of services. We actually heard from our patients, maybe people like you, that they wanted access to care after hours with their doctors, and not always needing to go to the emergency room or the ICC at Tully when they weren't feeling well, when it wasn't regular office hours. These new locations not only make care more convenient and accessible to our patients, but they also reflect our deepening commitment to the communities we serve. As we grow our footprint, we're also growing our role as a vital part of the local economy and workforce. Another reason that our community is so important to us is that Stamford Health is the largest employer in Stamford, and in turn, one of the largest employers in Fairfield County. That means that not only our patients come from our community, so do many of our doctors, our nurses, and our other staff. Many of our doctors and nurses and other staff live in Darien, in fact. So when we say that we are focused on the healthcare needs of our community, we take a very broad view of those needs. Stamford Health's clinical services are crucial, of course, but we don't and we can't just stop there. Anything that affects the health and well-being of people in our communities, whether it's medical or not, whether it's local or national, or even a global factor, holds great importance for Stamford Health. And so we devote a great deal of time and effort into making sure that the CHNA is an accurate and comprehensive picture of the health and the health needs of the communities we serve. We assemble a large team of community partners because we believe that the CHNA is not a Stamford Health document, it's the community's document. Then we use the results to develop a plan in collaboration with the Stamford and Darien Public Health Directors and dozens of other partners to guide our interventions for the following 3-year period. The good news is that based on the assessments that we have done and plans that we have put in place in 2016 and were repeated in 2019, 2022, and now in 2025, we and our community partners have made a tremendous positive impact. The bad news, as you will see in a moment, is that the challenges we face are so powerful that many of the measures have remained unchanged or even worsened. For whatever reason, the lingering effects of COVID, social media, political divisiveness, inflation, the needs of our communities are greater than ever. And this is daunting for us and probably for the communities we serve, but we are not discouraged. I can tell you that the people of Stamford Health are determined to fill our mission no matter what the difficulties are that we must overcome. Your presence here with us shows that you share our goals and you want to know how you too can make a difference. So before we delve into the specifics of the CHNA, let me recognize some of the individuals and organizations who have made this event possible. I would like to thank Mindy Chambrelli, the Darien Director of Health, who along with Jody Bishop-Poulin, who's Stamford Director of Health, provided a great leadership in developing this report. We must speak with those health directors and help them guide our efforts because they truly have their finger on the pulse of the health of their communities. A little later, you will hear from our consultant, one of our consultants, Jennifer Smith, along with Mindy Chambrelli and the Director of Human Services for the town of Darien. Ali Ramstek, sorry. Although she is unavailable to be here today, I would like to recognize Anka Badarina, the former Executive Director of Building One Community, for her work on our CHNA. Thank you all for your leadership and your participation, and I look forward to hearing from you soon. Finally, my special thanks is to our own team, Maggie Vergati and Emily Stokes on the Stamford Health team, and Brittany Dubé of the City of Stamford Department of Health for actually doing the work to develop the Community Health Needs Assessment Report. And to Ben Wade, who you'll hear from in a moment, who is our Senior Vice President for Strategy, Market Development, and Marketing and Communications, and Dr. Rohit Bala, Dr. Henry Yoon, Samantha Henderson, and Laura Jordan, who you just heard speak a few moments ago, for their leadership on these issues. The 2025 Community Health Needs Assessment has a great more data in it than we are going to present today. We have copies of the full document at the table in the back of the room, and I would encourage you to take a copy and spend some time to get a more nuanced picture of healthcare needs in our community. But right now, to deliver an overview of the report, I want to hand things over to our Stamford Health leader, who serves as the executive sponsor for the CHNA. Please welcome our Senior Vice President of Strategy and Marketing and our Chief Strategy Officer, Ben Wade.
Hi, everyone. So nice to see all of you. I really appreciate everyone being here today. As Kathy said, we really see this as a community document, and to have all of you here today indicates that you're as interested as we are in the health and well-being of the communities that we serve. So I am going to be walking you through a lot of statistics and numbers here, which is kind of my jam, but I am excited to answer questions that you might have about the data that we're presenting as part of the Q&A session later this morning. As Kathy mentioned, we work together with our community partners on our Community Health Needs Assessment, and this is actually the fourth time that we've done a CHNA. Each time we focused on the city of Stamford and the town of Darien because those are the two municipalities where we're the primary provider of inpatient services. And in many cases, the data I'm going to show you will compare Stamford to Darien, as well as to Fairfield County overall, and to the state of Connecticut. So what are our goals when we put together our Community Health Needs Assessment? Well, we have three. The first is we want to provide an overview of the demographics of our community, the social determinants that are impacting people's health and well-being, as well as the overall health status of the people who live in our community. The second goal is to prioritize the health needs that we've uncovered through that assessment. And the third is what we're doing today, which is to encourage dialogue and foster collaboration among our partners. Because this is not just about sharing the information, it's about what we and what all of us do together with this information. Just as a little aside, I got a annual report from SilverSource. Are people familiar with SilverSourcing? Yeah. What they talked about everything that they accomplished last year, but in the first section of all of their impacts, they were talking about housing. And in that section, they were talking about how our last Community Health Needs Assessment identified housing as one of our community's top health needs. And that really, made me smile, because it meant that the information that we're pulling together today isn't just informing what we're doing, it's informing what organizations across the community are doing. So it is astonishing to think about how much has changed since our last Community Health Needs Assessment. I don't have to issue a spoiler alert to tell you that it has been a tumultuous 3 or 4 years in the United States of America. There are events and trends that have impacted us nationally, and those national impacts trickle down and impact each of us in our communities. Unfortunately, as Kathy indicated, some of those broad national trends have meant many of the problems that we identified in our past community health needs assessment have been unchanged or even in some cases gotten worse. And that is despite a lot of effort and accomplishments on the part of Stanford Health and our community partners. It means that the things that we're bringing forward today, we really need to focus on it together as a community and develop effective plans if we're going to turn the tide on some of the trends that I'm going to be talking about over the course of the next 3 years. For our 2025 Community Health Needs Assessment, we followed a similar methodology to the methodologies that we used in 2016, 2019, and 2022. This makes this Community Health Needs Assessment even more valuable because it means that we can compare against the trends that we have uncovered in prior years' assessments. For the quantitative part of our assessment, we leveraged a statewide survey that was put forward by Data Haven, the 2024 Data Haven Community Wellbeing Survey. We used the same survey as every other hospital doing their community health needs assessment, which means we can compare quantitatively our community to other communities across the state. More than 7,500 adults participated in the survey statewide, and that includes almost 450 in Stanford and almost 100 in Darien. And many of the charts and graphs that I'm going to show today come from that Data Haven survey. And the one thing I'll point out is that that is not a huge sample size. And so there is some there is some band of statistical significance here. So we should take that with a grain of salt, especially as we're looking at Darien's numbers. However, we validated the information that we learned from the Data Haven survey with other quantitative resources like the US Census, the CDC, the State Department of Public Health, and the Connecticut Health Information Management Exchange. And even more important, we went out into the community and performed qualitative assessments, speaking with over 200 unique people across the two towns, either in individual interviews or in group focus groups. And those interviews and those qualitative assessments validated the findings that I'm going to discuss with the quantitative. When we look at the community health needs in our area, we have to recognize that the town of Darien is different than the city of Stanford, and that both of them are different than Fairfield County and the state overall. We certainly live in an area with a very diverse population. Although Darien is smaller than Stanford and it's less varied than either Stanford or Fairfield County overall, the community health needs in Darien are just as important as in Stanford and in the county overall. There's also a variety of age distribution. 31% of Darien residents, but only 18% of Stanford residents are under the age of 18. On the other hand, all of these populations continue to age, with 14% of Darien residents and 16% of Stanford residents over the age of 65. An increasingly important demographic trend is health insurance coverage. Even in Darien, a portion of residents make use of public insurance, such as Medicare, which is for the over 65 population, and Medicaid, which is for lower income Americans. And while enrollment in these programs has not shown an upward trend since the last community health needs assessment, they do remain essential for those who depend on them. As we think about where we are right now in the policy landscape, we do expect that if the one big beautiful bill if changes aren't made to the law that was passed, we will see a reduction in Medicaid coverage in our communities, as well as a reduction in Affordable Care Act supported private commercial insurance because of the tax support that has been in place up until now. So cuts to Medicaid and the Affordable Care Act could lead to a rise in the number of uninsured or underinsured individuals in both towns. As the variety of the population increases, so does the number of languages spoken in our area. This chart shows that it is much more likely for a family to speak a language other than English at home in Stamford than in the rest of Connecticut. 41% of Stamford residents, for example, speak Spanish at home, compared to 23% in the state overall. In addition to the demographic factors that I just talked through, we also look at what are known as the social determinants of health. We know that certain conditions about where people are born, live, work, play, and worship all have a huge impact on their health and well-being. These conditions we bucket into 5 domains, and those domains are education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. I'm only going to touch on a small number of the statistics that we learned through our assessment today, but there is a ton of rich data in the full assessment, which you can find in the back or on our website. We have to understand how these non-healthcare factors impact patients' health and well-being, and then even though our mission is focused on healthcare, we do what we can to support and help the community address these issues as well. Without exception, across the nation, we've seen that these social determinants of health have worsened since the pandemic. You'll see this is true not only in the United States, but also in Darien, Stamford, and Fairfield County. And while some of these measures improved somewhat during the COVID years, likely due to some increased focus on health and financial assistance programs, we have seen these factors take a step back in recent years. And that, to me, was the most surprising finding overall of the Community Health Needs Assessment. Okay, so let's dive in. It will surprise none of you to know that housing is a big driver of financial stress in our area. Darien's median home value is about 6 times higher than the median home value in Connecticut, but housing insecurity in Darien is considerably higher than in 2018. So here we're looking at the left-hand side of the slide, those bottom sets of charts, or those bottom bars are about Darien. Looking at the right-hand side, this is about food insecurity, and we've seen that food insecurity has increased markedly in Darien and across Connecticut. The number of residents reporting that they do not always have enough money to buy food is notable, with an increased percentage of individuals struggling to afford food as compared to prior surveys. To better understand our community needs this time around, we expanded our outreach efforts, as I said, and interviewed approximately 115 individuals across 36 community organizations. So while it's difficult to draw direct conclusions about food insecurity from survey sample sizes alone, especially in smaller communities like Darien, we did hear anecdotal evidence from local leaders who noted a rise in individuals seeking food assistance in Darien. The next domain that we're going to look at is social and community context. This is all about the relationships that we have with our family and our friends, our coworkers, and our neighbors. And again, these factors are closely aligned with healthcare outcomes. Unfortunately, this is one of the areas where we've seen the greatest declines since our last survey. While most residents still consider themselves satisfied with the cities that they're in or the areas that they live in, the majority has declined by 5 points in Connecticut and Stamford and 8 points in Darien in just recent years. Similarly, trust in local and state government is still relatively high, which is good. But we're seeing that fewer than half of the residents in our area say they have an even fair amount of trust in the federal government. The final social determinant of health is the one which is most closely aligned to the work that we do at Stamford Health, and that's healthcare access and quality. We can be pleased that overall people in Darien and Stamford have access to timely, high-quality healthcare. In Darien, Darien achieved a score of 89 out of 100 on this metric, and Stamford achieved a score of 83 out of 100. And that's based on health insurance, uninterrupted medical care, recent dental visits, and having a designated medical home. The richness of the CHNA data, though, reveals to us that there are growing areas of concern. On the left, we can see that many of our neighbors are sometimes unable to get the medical care that they want or need. And the reasons for that can vary. It can be transportation or financial pressures or long wait times to get into appointments. One way or another, as many as 1 in 6 residents in our area have not been able to access needed health care. In 2021, we thought we could explain that as a result of the rise of COVID and the restrictions on access, but problems with access have actually increased significantly in Darien and declined only slightly in Stamford. Another very concerning trend is the decline in trust for health officials and healthcare workers. And this is alarming because residents of our community have to be able to trust the information that they receive if health outcomes are going to improve. This is part of a national trend. It goes beyond healthcare. There's a declining trust in experts and expertise in many areas of society. Looking at another healthcare factor, mental health, this is very closely related to overall health and quality of life. On a national level, you often hear the word crisis referred to when we talk about mental health. We have seen declining health indicators in our community related to mental health in our survey. And there are many reasons for this: an uncertain economy, divisive politics, social media, post-pandemic isolation, among other factors. There's also a shortage of mental health professionals nationwide and a funding crisis. Unfortunately, in Darien and statewide, overall satisfaction with life has declined by 8 percentage points since 2015, and in Stamford, the figure is 14 percentage points. At the same time, anxiety is climbing, with Darien showing a particularly pronounced 11-point rise since 2021. These are just a few of the factors that you can learn more about in our community health needs assessment. But as I said, information alone isn't the goal. The purpose is to help us identify and understand the biggest health challenges in our community and then to take action. And so what we've done this time around, as we have with our past surveys, is worked with our community partners to identify our most pressing needs. We asked, what should we address to have the biggest impact on the most people? And this exercise revealed 3 core priorities: behavioral health, access to healthcare, and housing, and then 3 to 4 sub-areas under each one of those pillars. This will be the framework that we at Stanford Health, as well as our community partners and local leaders, use to put together what we call a Community Health Improvement Plan, or a CHIP, which will be done by February of next year. If you attended our community conversation last time, these 3 priorities will sound familiar. In fact, they are the same priorities that we discussed in our last community health needs assessment. It's a difficult story to tell, and these are really, really big problems to solve. There are nationwide challenges that have been made worse by some of the lingering effects of COVID, as well as shortages of physicians, nurses, and other healthcare providers. But what I can tell you is that we, along with our community partners, have taken very specific actions over the course of the last 3 years to address what we identified as the priorities last time. In the area of behavioral health, for example, we've made behavioral health a priority in our overall strategic plan. We've completed strategic plans specifically for behavioral health. We've added physicians and staff. We've opened additional beds in our hospital. We've vastly expanded our partnerships with partners like Liberation programs, and we've started to offer outpatient clinical services for behavioral health, expanding at 260 Long Ridge Road just a couple of months ago. On the access front, we've onboarded new physicians, 12 PCPs and 4 primary care advanced practice providers over the course of 2023 and 2024, which makes access easier by expanding capacity. We also added locations and walk-in clinics to several of our primary care locations. We hired community health workers to go out into the community and work specifically with underrepresented groups, and we delivered vaccinations and blood pressure checks at community health fairs. On the housing front, although Stanford Health is not a housing provider, because this is such an important factor, we've been focused here as well. We work closely with public and private organizations, including the City of Stanford, Charter Oak Communities, Pacific House, and Inspirica to help create affordable housing and help residents of our communities afford higher paying careers or prepare for higher paying careers. And we've added our voice as the largest employer in the area and an organization that maintains strong relationships with businesses, politicians, and community leaders. And we will continue to do this, investing financially and providing volunteer service on the part of our executive team to these organizations. So I hope that this overview has been helpful to you. Throughout, we tried to make it very clear that this is a community project. This isn't just for Stanford Health to try to address. Therefore, to continue the conversation, we've asked several experts to come and share their insights and perspectives on what the community health needs assessment contains. They will be interviewed by one of our lead authors and researchers, Stanford Health's Director of Strategy, Maggie Vergati. And remember, we are collecting questions. And so if things come to you, questions you want to ask, please fill out a form or fill out an index card and then raise your hand and we'll collect them so that we can ask them at the end of the panel discussion. So please welcome Jennifer, Mindy, and Allie. Thanks so much, guys.
All right, thank you, Ben, for that great presentation. And good morning, everyone. Maggie Vergati, Director of Strategy at Stanford Health. It's great to be here with you all this morning, and I'm thrilled to be joined today by individuals who played a really vital role in our community health needs assessment. These panelists were not just part of the process and participants, they were really architects of the process and not only helped us to build the report, but really helped us to understand from boots on the ground what's happening in these communities. They were chosen because of their deep expertise, their connection to the community, and their ability to translate what they heard throughout the process into really meaningful insights for us. We have Jennifer Smith over on the end. Jennifer brings a wealth of experience in community engagement and data synthesis, including her prior work with the City of Stanford and the area's community health centers on issues of public health and health equity. She really helped to ensure throughout the process that the voices of residents were not only heard, but also understood in the context of some of the data that you heard earlier. We have Mindy Chambrelli, who I'm sure you're all familiar with, the Director of Health for the town of Darien, and Mindy offers a community lens that's really grounded in the local realities. She's seen firsthand how health trends play out in the community. And then we have Allie Ramstek, the Director of Human Services here in Darien, and Allie brings a unique perspective on the social services landscape and the lived experience of the residents here in Darien. So her work connects directly to the challenges and the strengths that surfaced in the CHNA. So we're incredibly lucky to have them here today. We're excited to hear from them and be able to share with you all. They've seen and heard the challenges, heard the stories, and are also helping to shape the path forward. And this panel will really give you a behind-the-scenes look into the CHNA process and what we learned, and also what it means for the future. So we're hoping that by the end of this, you'll walk away with a clearer understanding of our community health's landscape, the voices that informed it, and how we can all work together to move forward. So let's jump into the discussion. First, we're going to talk a little bit about the CHNA journey itself. I'm going to start with Mindy. So Mindy, can you tell us a little bit about your experience of being involved in the CHNA process and maybe how it compared to your expectations in entering this process?
Okay. I will say that I've made some really terrific connections just by being involved in this process. I met people that, are doing things that you may not even be aware of in our community. So what I will tell you is that the whole purpose of a community health needs assessment is really to empower our community to make some decisions about what we should do to improve health outcomes now and into the future. So just bear in mind that. Yeah, and I think it met my expectations. I think that you can see that this reflects what was identified 3 years ago. It's no surprise to anybody that these are 3 themes that are rising to the top. So I would encourage anybody to ask a question and get more involved.
Thanks, Mindy. Allie, we'd love to hear from you too.
Well, I think it's been a wonderful experience for me getting to collaborate with people I've never worked with before. Mindy has worked a lot more with, obviously, with the health directors and local health providers, but it was very enlightening and not surprising, some of the results that we found, obviously, particularly related to the behavioral health needs, which has been a concern of ours here in Darien, and also the food insecurity in housing, which is some of the primary reasons that people come to my department and ask for help. So
yeah,
it's really
that's great.
part of it.
Thank you. And Jennifer, you bring a little bit of a different lens because you worked with Anka to give all of our interviews, which was great. So would love to hear about your experience.
Sure. As Ben mentioned in the beginning of the presentation, we interviewed over 200 people here in Stamford and Darien, both from organizations, but also people who are just regular people in the community. So that ranged from daycare providers to day laborers to people who have lived here in town their entire lives to people who have just chosen to move here maybe in the past several months, several years. So really a cross-section across our community here and across the 2 cities together. I will say I myself was not involved in the CHNA 3 years ago, but Anka was, and I think I want to give special recognition to Stamford Health for creating the opportunity in this year's CHNA for Anka and I to really listen deeply to the community by doing these very in-depth interviews. We learned so much in addition to reemphasizing or verifying what the data was showing us in terms of the top issues. But hearing how these issues are playing out day to day in people's lives, we learned, which I think we'll talk about in some of the future questions, some really interesting and troubling ways that these issues are playing out in children's lives, in our seniors' lives, families' lives, in our workforce development in lots of different ways. So I really, again, want to thank Stamford Health for the opportunity to create that space for people to have their voices heard and going beyond just checking a box or putting a list on the screen, but really figuring out how do we hear what people have to say, hear their lived experiences, and then turn that into action.
Thank you, Jennifer. Really great to hear about all of your experiences. Obviously, it was great to have you all involved in the process. And like I mentioned, each one of them brought a unique perspective and helpful information to help us understand the communities. So now let's get into the interesting stuff, which were the findings. So Ben obviously shared some of the data with you and what came out of our priorities, but we'd love to hear from the panel what the most compelling findings were from your perspective. So Allie, you want to start us off?
Sure. Being a licensed clinical social worker, the behavioral health needs was obviously a priority for me, and not surprisingly, one of the major areas of concern from the study. I'm thrilled to see that Stamford Health opened the outpatient services now, because as you know, many of you in the audience know that finding mental health providers in our community and nationwide is really a challenge. And 3 years ago, our town suffered multiple deaths by suicide in a short period of time, and the local professionals, nonprofits, leaders, and mental health providers all gathered together and created a mental health task force. And as a result of that, we've also heard from the residents that finding providers and trying to navigate or having people call you back and that kind of thing, but people that are, or providers that are actually taking new clients and or insurance, was a major issue. So we actually do have on our town website a list of providers that we update every about 3 months so that people can help. It can just kind of streamline where they can find someone if they need professional psychotherapy or psychiatric help. So again, that's a major problem nationwide, but not surprisingly, it is also local to our community, a big concern. And then in my department for human services, the food insecurity has been an issue increasingly. And we see people asking us for food assistance, for gift cards, which we can't do on an ongoing basis, but there's definitely been an increase in that. I know personally, I don't like going to the grocery store. Everything's so expensive, right? So you feel it. And if you're living on a fixed income, it's having a huge impact. And one of the other probably number one calls that people call to our office about is affordable housing, which has also listed. So the main topics that have come from this are all very relevant to our community. I know there's even more of a need in Stamford, but we do have a need here in Darien as well.
Yeah, thanks, Sally. I think Ben mentioned it earlier that these communities, you know, they may be different in some circumstances, but they're facing a lot of the same challenges. So it's important for us to be thinking collectively about how we can make an impact there. And just to add to what you said, Allie, I think what's interesting, and would love to hear from some of the other panel members as well about what was compelling, is all of these things are very interconnected. When you're experiencing behavioral health issues, you know, if you are struggling to afford housing, that can impact your mental health. Being able to access, you know, behavioral health services relates back to access to health care. Food insecurity relates to preventative measures. So all very important things. Mindy, I'd love to hear about what you found most compelling in the report.
Well, Allie touched on a lot of things I was going to say, but I will just mention that I think navigating the system, although we may have providers out there, I think is really a challenge that I hear in my office, is where do we start? How do we navigate the system? How do we get the resources we need? So, you know, I think we can collaborate more on that, of trying to, you know, connect people to where they need to go. Allie's done some work putting together a list of providers on her website specifically for behavioral health, but still there are providers out there that don't take insurance, right? There's a lot of fee-for-service that's happening in our area, a lot of retainers for physicians. So, you know, I think that whole insurance topic is huge right now, and it's something we should work a little closely with.
Thanks, Mindy. And Jennifer, would love to hear also what you found compelling, but if you also have any stories or themes that you heard specifically in the interviews, I think that'd be great to hear.
Yeah, I think, you know, there's so much to say about mental health and behavioral health right now in our country and in our town, and certainly for our youth facing so many struggles and challenges. One of the things that we certainly heard across both Darien and Stamford is the concern about rising, whether it's stress and depression, and then how that plays out in other ways, whether it's substance abuse or other destructive behaviors. What I do want to highlight a few things that we heard here in Darien. So for example, at the interview in the Darien YMCA, Jennifer, some of you probably know her, was the issue about youth mental health and how that is translating into increased substance abuse and use of alcohol specifically, and that is on the rise after years of declining, which is out of step with what we're hearing nationally, that in general, younger people are not drinking as much as maybe back in the 80s or 70s or earlier. But in these instances where we have people who are experiencing such stress that it is then translating into these patterns of behavior with drugs and alcohol that we can't ignore. Along with that also is the issue about stress and pressure that our young people are feeling today to succeed, right, with the economy, with the pressures for success. And so thinking about how do we support young people, and by that I mean both kids, right, in elementary school, but even up into middle and high school. How do we create times for them in their day and their week where they're not feeling so much pressure to be perfect and so much pressure to be always working, always achieving, and just creating some unstructured time in our children's lives for play. Some of us here in the room may remember from our childhoods that was common, right? We would run around the neighborhoods and have lots of unstructured time, and things have changed. And I think here in Darien especially, there's lots of pressures to succeed, but we need to make sure that we're not pushing people too far and pushing our young people too far and not giving them that space just to enjoy life and to enjoy being young people. On the flip side, I'll just say if I have time, also for our seniors here in the community, we're also hearing a lot of similar mental health issues, but for different reasons. So, for example, in interviewing Post 53, EMS here in town, one thing that we heard about was that for the first time that mental health issues had risen to the top 5 reasons for calls that they were getting for ambulance services. And they were really struck by that. A lot of that is for seniors, right, living maybe home alone. Their children have moved away or aren't able to afford to live here in town. And so they are experiencing a lot of loneliness, which translates into depression, which then can translate into things like accidental falls, and that leads into health issues, right, and injuries. So I think we have it across the spectrum, right? Our young people, our people in mid-prime of life, and then also in our senior population who are still very active, but are increasingly finding it difficult to access transportation and therefore becoming more isolated. So I think we have a lot to do on the spectrum of how do we support healthy lives and mental health.
Thank you, Jennifer. I think, again, that highlights the importance of the social determinants of health and impacting all these health factors. And throughout the process, Jennifer and Anka actually produced a 200-page document from all these interviews. So there was a lot of really rich information in there, and it really helped us to understand what was happening within these communities. Mindy and Allie, you guys had a first row seat to the prioritization process, and sorting out all of the challenges that we heard through the interviews and the data, and that was influenced by both the qualitative information and the quantitative information. So I'd love to hear about your thoughts and experience on prioritizing these needs, and how that went.
Sure. So the several times that we got together as a group and really sat down, and even breaking off in separate groups, all of those themes were rising to the top, regardless of what the structure of those groups were and what was the composition of them. So I think it was easy to determine what those priorities are, because the data, both qualitative and quantitative, really spoke volumes. And I think that was an easy part of the process. It was very clear what they were.
Mindy's more of a data person than I am, but I think one takeaway for me was just how daunting these issues are, right? So, and like we said, these were similar issues that came from the last CHNA, and it's a little overwhelming. Like, how do you really tackle these and make a difference? I mean, it's going to be a long process, but as I've said before, behavioral health is really important to me, and I'm glad that we are trying as a community, not just Darien, but also with Stanford Health, to make access more available and more easier, and hopefully somehow increase the amount of providers, and providers, like Mindy said, that take insurance, because not everybody can pay privately for a therapist for $200. I know I personally can't. So I think just really focusing on the behavioral health, to me, which we know has impacted the whole country, but definitely our community feels it as well. And I think it was 14% that the increase in Darien, and that's significant, and we feel it.
Yeah, definitely important. You've all touched upon the social determinants of health a little bit, and how important they are, and I know Ben talked a lot about how they impact the health and well-being of the community, but I want to hear a little bit more about these social determinants. I'm going to start with Jennifer, your experience through the interviews and how you heard them come through and how they're connecting back to people's health and well-being.
I think I'm sure I'm preaching to the choir here, but many of us know how interconnected our mental health is to our physical health. Having access to healthy food then means good health. Having access to basic financial needs reduces stress, or vice versa. I think I want to use the example, again, kind of going back to our seniors here in Darien. One of the issues that we heard a lot about was about their concern and increasing difficulty in affording housing and staying either in the house that they're in or finding a place to live here and age in place here in Darien. And so that stress was creating a lot of emotional stress and depression and concern. The financial pressures that they were feeling also, again, led to spending more money towards housing, then meant less money for things like groceries, as I think you mentioned, Ally. Buying less groceries or less quality groceries, less fresh food means, we know, lower quality of health and lower nutrition. In addition to that, then, the lack of transportation, either because they have aged out from being able to drive safely or lack of transportation options, that also meant that they could not visit friends and family, so that was a social cutoff, but also what we're hearing, not just from the senior organizations, but also from healthcare providers, is the number of seniors who are missing healthcare appointments that they have scheduled, so they've made it through the phone tree, which we've heard from many seniors was very frustrating at some agencies with just getting through the phone tree. I'm sure we've all had that experience. But then, because they don't have access to transportation, whether that's a car themselves or another mode of transportation to get them, the number of people missing healthcare appointments is increasingly becoming a problem. So it really does become, I think, an interconnected web of issues. I do think that this process, although the CHNA is very thick with information, it gives us a really good pathway, and then now leading into the next phase, which is the Community Health Improvement Plan, really creates a roadmap, which for me at least, when I feel overwhelmed with all of the problems that we're facing in society and in our town, having that roadmap really gives us a clear pathway to feel like we are making progress in a time when it may feel that in general things are moving backwards, that we can at least measure that progress and be able to report that back to the community and hear, is that working? Is that what it's needed? What else can we do? So I think, as Ben, you mentioned, right, there have been improvements, and since the past 3 years, specific actions to address some of these issues. And now the next step is figuring out where we go from here so we can feel not so overwhelmed by the daunting challenges ahead of us.
Yeah.
I'd like to speak on the senior population. So recently the senior center became under my umbrella, and we did a survey of the members, and quite a few of them did mention wanting more mental health kind of supports. So we did start a grief group, and now they have a meditation class, which was a real big hit, and now we're going to try to offer that twice a month. They want more speakers to come in, so they are voicing their concerns and that they're struggling. We're pretty fortunate here, or we are very fortunate here, that we have a aging in place organization at home in Darien, similar to Silver Source in Stamford, that does provide transportation, but I think we just need to help continue to educate our residents that there are services. They can get rides to doctor's appointments, they can get rides to get their hair done, they can, or socialize, anything. So Chris Jones was here, but he had to leave, but I think he was part of the interview process, right? Mm-hmm. But yeah, just trying to address the loneliness and the isolation that our seniors are feeling.
If I just, oh, go ahead. No.
I think on a very positive note regarding the social determinants of health, we have a very educated population that does have access to resources, but I think the key is navigating, right, and being able to connect to what they need in real time, right? So again, I think overall, please take the report, read through it. I know that we have to identify, strengths, and we're looking at, gaps in care, continuum of care. But overall, Darien, we're pretty healthy. We're in good shape here. So I just wanted to say that really positive message that, these problems are not unique to Darien, they're across the board. But overall, I would encourage you to really look at the data that's presented, because it's very positive for our community.
Jennifer, did you have something you wanted to add as well?
Oh, I just wanted to build on what you were saying, Ally, that one thing we heard in the interviews from organizations and then also from individual residents was the sort of challenge in communicating all these great resources that exist. And one of the questions that we asked the 44 organizations that we interviewed was, what are you finding as the most effective ways to communicate information to your constituencies that you serve, and how do you receive information back? And actually we found that was a real struggle, that no one had I was hoping to learn the magic answer, and actually I think a lot of us who run organizations are struggling with figuring out, how do we get that information? A lot of people said that they didn't know where to find their information, they didn't know what the resources were, they were finding that people said they didn't know what the XYZ program was available. And on the flip side, I think a lot of us are trying things, whether it's social media, whether it's newsletters, whether it's email, whether it's flyers. And I would really encourage organizations in the community maybe to get together and maybe have a lunch and learn or ongoing conversation to figure out how could we maybe be more effective and more efficient in getting information, and then asking residents, are they hearing it, and where do they want to find that information? Because I think that was a big gap that we were not expecting to hear, given the wealth of resources that we have and the wonderful programs and health services, but people are, for some reason, that information isn't quite connecting yet. So I think that's an area that we could really work in partnership as a community to figure out.
And the town of Darien a few years ago did start a town newsletter, and I know that that's continuing to grow, and so a lot of information is in there, so I encourage anyone in the Darien community to sign up for that newsletter. It's every other week, and it has all this information that we're talking about, so just trying to get the word out.
Yeah. I do want to transition to talking about engagement and action as we wrap up, but one of the things I want to call out is throughout the interview process, all of the participants were also asked about what was going well and what the strengths were in the community. And I know we're talking a lot about the challenges today, but we did hear a lot of great things about community partnerships and how things have improved over the years. And so when we're facing these challenges, you know, Ben talked a lot about what we've done at Stanford Health with our community partners, but we're not starting at square one. We already have a good basis for continuing to build upon these things and make an impact. So just to wrap it up here, I think one of the biggest questions is what you want the community to take away from this and how can they get involved? And Allie, we'll start it off with you.
Well, I hope that the community realizes that we care and we're available and we're here for everybody. So I'll speak for Mindy too, but I mean, anyone can reach out to us. We are here to be a resource to any resident in Darien and to help them navigate whatever challenges they might be having, whether it's finding doctors, mental health professionals, housing insecurity, whatever their issues are, we are available. And I hope that we want to make that get the word out there.
Thanks, Allie. Mindy?
I would say, yeah, active engagement and, you know, by our community members. And if there's something that you're feeling or seeing or hearing from your neighbors, you know, be vocal about it. We're not going to know what's happening unless we're hearing from you. So, you know, Allie and I are here all the time. You can reach us via email, come to our websites. I will also link the Community Health Needs Assessment to our website as well. But if there's any data as you're reading through and trying to digest all of the good information that's been pulled together, I would say, you know, challenge things, ask questions, you know, so we have a better understanding of maybe things that we're not aware of that are happening.
Well, I really want to build off what you just said, Mindy. Just a quick show of hands, how many folks here are from organizations that are social service or healthcare? I just want to... So I would say, if I can answer it in two parts. Yeah. One, I would say, you know, we are experiencing a huge ground shift, right, in economics, social, political, what have you. It doesn't matter where you are on the spectrum of those issues, but things have changed so much. We were talking before the event today about, you know, we did these interviews this time last year, and the data was collected around that same time, and it does feel like it has been a lifetime since we did those interviews. I would say for those of us who are in organizations to, right now, when it feels like some of these issues are so huge, as you mentioned, Allie, and so overwhelming, that this is an opportunity because people are looking for trusted community resources and trusted community partners, that this is a time perhaps to consider really taking some opportunity to listen deeply to your, whether it's members, constituents, community, and hear what they need, because so much has changed in the past year. Even though the big framework issues are not changed, how people are experiencing mental health, affordable housing, access to healthcare may have shifted or is about to shift with some of these changes, for example, with our healthcare. And so creating that space to listen deeply and just have your community or constituents tell you what they are experiencing and what they need, I think right now is a way we could really be helpful. One thing that came up in the interviews was a lot of people, again, love their community, love the organizations and the partnerships, but they also expressed in several situations, frustration with what we were calling sort of friction points. So just barriers within our organizations that we are, without intention, unintentionally creating trouble for people to access the services or access the programs that we have created, but they can't quite get there. So whether it's a complicated phone tree, or whether it's the form is not available easily in the languages of people who are coming into the waiting room. There's just lots of different barriers that we didn't necessarily know about and that didn't come up. They don't come up in a checkbox survey, but creating those opportunities to maybe check in with your patients, people you serve, and just hear what maybe some of the friction points that we can eliminate within our own operations. It's not going to solve the entire problem of affordable housing. It's not going to solve the entire problem of access to health care. But if we can make what we're doing a little bit more accessible, a little bit smoother, and report back to then our folks about what changes we've made, I think really builds that trust, and that's going to make us stronger in the long run. So I, again, just encourage to take that time, create that space. It doesn't need to be a massive year-round operation. There's ways to do it short-term, long-term. And then just to maybe close out with sort of looking forward, I would say also we as a community should really be thinking big and acting bold, which is exactly opposite what I just said about thinking, looking internally and thinking small. I know, but I think the next step with the community health improvement plan is an opportunity to really, we need to be thinking big, because these are big problems that are going to require a long-term plan. And if we shy away from thinking that we can't accomplish what's needed to be done, I think we won't be able to get there. And so I would just encourage us to continue to be bold as Darien and as Connecticut. We've accomplished great things, and we can continue to do so going forward.
Yeah. Well, thank you all so much for your incredible reflections and thoughtfulness throughout this process. Just to kind of close what you were all saying, I think we're all excited to take the next step and look forward, and we've learned a lot through the assessment, and now we're thinking about how we're going to tackle these things. And that doesn't just involve Stanford Health and the people at the table, it involves many people in this room, and we're really looking forward to collaborating on that work. So thank you, and I hope you guys learned some additional information from this panel.